Moving on, Nigerians have now been charged to prioritize their health and consider preventive measures as a fundamental part of their overall well-being. They were also charged to take responsibility for their health by making regular checkups a routine part of their lives. This charge was handed down by the Managing Director of Cerba, Lancet, Nigeria, Dr. Olayemi Dawodu, while speaking during a press conference on the theme Assessing Preventive Healthcare in Nigeria, Barriers, Challenges and the Future, held in Lagos, while emphasizing the importance of investing in preventive healthcare as a critical step towards likening healthcare investment to investing in one's life. Dr. Dawodu underscored the long-term benefit of early intervention and disease prevention.
The impact of neglecting preventive healthcare in Nigeria goes beyond individual health. So it goes beyond you and I not knowing what is going on with us, but it has an economic impact. And it has an economic impact because when people do not check what their status of health is and they come down with diseases, usually we've also found out that in Nigeria, people present very late with their disease entities in complicated states. So apart from the healthcare outcome for the individuals who are affected by these diseases, it places a burden on the healthcare system because the facilities and the infrastructure and the expertise that is required to be able to handle complicated cases is more far-reaching, it's more expensive, and we don't really have enough personnel to deal with that. So it behoves on us the reason why we must ensure that we regularly check our health status.
Another issue highlighted was the crucial role of follow-up care and accurate diagnosis in ensuring optimal health and early detection of potential health issues, which in his overview, the Group Chief Executive Officer, Matthew Gog, explained that while many individuals may feel fine, underlying health issues can often go unnoticed without proper medical investigation. He stressed that follow-up care after initial diagnosis is equally important to track progress, address any emerging concerns, and ensure that treatments are working effectively.
You will run for 100 years without a problem, without a disease, or small disease like flu or things like this, and not serious one most of the time. So it's all about culture, because I know in Nigeria a lot of people are not servicing their car. They just wait to have problems with it. But there, they spend too much. And so it's all about a cultural change, and we have to invest in education and why is it so important to do follow-up, to do diagnosis, to make sure your health is in a good shape and you will not have big impacts in the future. Because we've seen it during COVID. There was no way we could ship samples somewhere else. We had to produce it locally. But we've been able to create a PCR COVID platform very quickly, also because we were part of a group.
Average lifespan of a Nigerian is 54 years, and we definitely can do better. In other countries, people live up to their 70s. So if we take care of our health and we are aware of our health status at every point in time, then we're able to put in place things that ensure that we live longer. A person who is treating diabetes, hypertension, the costs have tripled from what they used to be in this current economy. So in terms of drugs that you were buying for 30,000 naira, maybe a few months ago, are now 90,000. And there's a cost implication. We know that most Nigerians access healthcare out of pocket. More than 70% access healthcare out of pocket.
When you look at the industry, we realize that there's an issue of free entry. There's really no regulator that controls entry into the industry. There are so many laboratories in Nigeria that are not regulated. Yet they do businesses with the government. I mean, they have their test results being taken to the hospital and to be recognized. It's very important for the government to control entry into the industry. Because you see, the industry works hand in hand with the healthcare, with the hospital. When you have a test result that is incorrect, it affects the treatment of that patient. There is no way they'll get the treatment right.
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.